welcome to Ecole 360. We are live in our Palatine location. My name is Miss Amy. I'm the director here, and this is Miss Stephanie. She is our pre-K teacher, and she is an expert on safe sleep practices and sleep training. So we're going to be talking a little bit about that today in our live. During our live, please write comments or questions in the comment box, and we will take care of those as we go. And please like and share it so we can reach as many people as possible. So we are very happy to be here at Ecole 360 at the Palatine location. Ecole is a French word. It means school. And 360 pertains to our full circle program. We are proud to have the best curriculum, best teachers, and best families like you. So we also have a 360 corner for our parents, and we like to provide resources for you all to answer your questions and support you. And our newest addition to those resources is these lives. So we'll be hosting one every month or so, and this is our first one. Myself and Miss Stephanie really understand how important your kiddos are, and being moms ourselves, we know how nerve-wracking it can be to drop them off at daycare for the first time. So we have a lot of experienced teachers here, and they're very patient and knowledgeable, and will really help you ease that transition from dropping them off. I have 3 children myself. Miss Stephanie is soon to have 2 children here. And so we're happy to be a big part of their foundation for early learning and help them grow socially, emotionally, and academically. So at this school in Ecole, we provide students with care from ages 6 weeks to 6 years. And our infant classroom, we have a ratio of 1 to 4, and it starts at 6 weeks old and goes through 15 months. And we have a very individualized program. So we do a lot of communicating with you before you enroll and while you're here to make sure that your program is everything that you expect it to be, and your child is getting everything that they need as far as feeding and napping. It's all based on what you guys expect and what you want. So a big part of that is safe sleep. So Miss Stephanie, what is safe sleep?
Well, according to what we do here at Ecole in the American Academy of Pediatrician, safe sleep is an ABC, which means A for alone. The baby should be sleeping alone in the crib. B, it has to be in his bag. And C, it has to be in the crib with nothing around there, like no pillows, no blankets, or any toy around, to make sure the baby is safe.
Wonderful. Now, a lot of parents might be wondering that they like to have a pacifier when they're sleeping. Is a pacifier okay for safe sleep?
Yeah, it's okay if as long as the pacifier doesn't have a cane or toy on the pacifier, it's good. When the baby is able to reach the pacifier, as a parent, you can throw a bunch of them around the crib, and the baby can easier reach the pacifier, and then he can go back to sleep in the room.
Okay, great. So they can kind of self-soothe when they have the pacifiers available too. Wonderful. So at Ecole 360, of course, we support safe sleep. So as Stephanie said, it's the ABCs. You want the child alone, on their back, and clear of all distractions and other items. So no blankets, no animals, anything else like that that could harm them when they're sleeping. We do provide a designated clean crib for each infant here at Ecole. Even if you are only a part-time child, you will still have your own crib. And we provide a clean fitted sheet. And a lot of parents are encouraged to bring noise machines. And Miss Stephanie, what is the benefit of a noise maker, like a noise machine, for the sleeping process?
Yeah. For the baby, helps to fall asleep like deeply in the correct way, because if we play like music or other type of noise for the baby, the brain is not gonna rest, and it's not gonna help to develop what the baby needs. For that reason, it's better we use the white noise, because it blocks all the noise around, and the baby can fall asleep deeply, and he can take his rest, like the perfect time that he needs to sleep, or the time he needs to take his nap.
Wonderful. And noisemakers, I keep saying noisemakers, noise machines are very helpful in a daycare setting too, because not all of our babies are on the same schedule. So since you're providing the sleep schedule and the daily routine, that white noise really helps in daycare setting to make sure that they can rest and have their brain activity level go down, even if other students might be awake or feeding at that time. So we really encourage all of our parents to bring those in too, to kind of make sure that their child is able to get the safest and most productive sleep as they can while they're here. Okay, what can parents do at home to make sure that they are putting their baby to sleep safely?
Again, we can follow this ABC rules, like a alone baby, no sharing bed, it has to be his bag, it can, in his crib, in his own crib. And then we can have other tools to help the baby make sure it's sleeping well, like having the exactly room temperature. It can be between 68 degrees to 71. The clothes the baby is wearing, like, it has to be the exactly clothes, like no blankets or anything extra. For the youngest, like for newborn to 8 weeks, until they know how to roll on their tummy, it's good if they wear a sleep sack holding their hands, like no hard, but something that make them comfortable.
Okay.
Because they have this reaction and that makes them awake.
Yeah, that makes sense.
After that time, sleep sacks are good, like to make sure the babies are warm and the right temperature. And then another good thing to have a good environment in the room can be like dark room. That helps the baby at night to fall asleep all through the night, because you're creating a good quiet and a good environment for the baby to make themselves, and he can fall asleep. So it can be dark, and the clothes, the temperature, and the white noise again.
Wonderful. Yeah, and all these things are really important, especially in younger infants, like Stephanie was saying. If you're creating the perfect atmosphere that's darker, especially when they're younger, it helps them to know that it's nighttime. And it helps their body to know, okay, it's time to rest. So if we have white noise, a dark room, we're in our own crib, we're in our own space, then it will naturally tell their body that it's time to rest. And I like how you said routines. So then you're getting them used to the routine of what they do when they go to bed. So their routine might look a little different at school than it does at home. At home, you might, have dinner and then a bath and a story, and then you take your nap or you go to bed. At school, it will look a little bit different, but as long as we're doing the same things in each environment, then the child will start to remember that it's time to rest, whether they're at school and it's time to rest, or they're at home. And at home, room sharing is okay, but not bed sharing. It's not safe for our babies. So that's another really good thing that I like that you said, to make sure that they are following the ABCs alone on their back and clear of anything else around them for the safe sleep. Wonderful. So I know that you have a lot of personal experience with sleep coaching and sleep training. So can you explain a little bit more about that? Like, how has it benefited you with your now toddler? And do you plan to use this again with your new baby? And just kind of tell us some of the pros of why it's such a great idea to do.
Well, me as a parent that I work, the first thing that you'll miss or you lose when you became a parent is the sleep time. Because you need to take care of for a new baby. And sometimes you don't know exactly what to do or what routine to follow. For that reason, I got this training to learn more about sleeping, because it's important not only for me because I want to take a rest or because I need it, but for the baby too, because it helps to develop cognitive skills. The first thing that I learned about that is how we can have a routine for the baby to help the good sleep. For my son, we take this training. It has to be for most of the kids, it has to be after 5 months, when the kids are more ready to don't have feed bottles at night or things like that. It depends what your pediatrician says.
Sure,
you have to follow that first. But in my experience with my son was okay, he's ready to eat 1 bottle at night. He's gonna be okay, as long as during the day he gets what he needs.
Yes.
And then we have a routine for my my son, it was like dinner, and then bed, and then we put him to sleep, and then we start training. Like we teach him how he needs to fall asleep by himself. He can fall asleep by himself. No, like holding him or rocking him. No, or like it can be with the pacifier,
Sure. Yeah.
but nothing else. So he needed to learn how to fall asleep on his own. So that was the first thing that we done. Having a routine. After that, we went to a hard part. Like putting the baby in the safe spot, but let him cry. I know it's hard as a parent. It's like, oh, you don't want to leave your baby crying,
Right.
Mm-hmm. But it helps the baby to understand that he can fall asleep in any way. Like that he doesn't need a mom or dad to be like holding the crib or things like that. So you put your timer, and then you walk into the room and you talk to your baby like, I'm here. You're learning how to sleep. I love you, like those kind of words the baby can remember. Okay, my mom's still there, but I need to sleep, You follow kind of, I don't know, with me, work like timer, like 15 minutes, and then 10 minutes to then I can go to the room, but never holding the baby,
Okay.
Like you need to make sure the baby is in his crib, like he can hear you that you're around, but you're teaching him to fall asleep in their own, And after that, well, with my son, it was, every baby's different,
Right.
But with my son, it was like, I think the second time, 10 minutes, and then minute 6, he falls asleep in his own, and then every day we try the same thing, but it was less time he took him to fall asleep until he'll learn, like, we put him on the crib, and then he falls asleep in his own. No more crying.
Wonderful.
No more,
That's the goal.
Yeah.
And now, how long, like how many weeks or days do you think it takes to successfully get them to self-soothe and sleep train?
Usually it takes for every new routine for even grown-ups 21 days. So it's not gonna happen like today, tomorrow. Maybe the baby is gonna fall asleep today, good, and tomorrow is gonna follow the routine again. But maybe the day after that it is going back. You need to repeat that over and over until you have your routine.
Great. Can you tell us some tips and tricks as a parent that might work really well for people that are new to this? I'm gonna drop really quick.
It can be like having a, well, first we already say we have a routine already, and then you can offer a good environment to your son, like good comfy clothes and nothing around the crib, no distraction, like so I know some decoration for the cribs they look good, but those are distractions for the baby, so it's not necessary to having them in the crib.
Right. Okay, very good. So do you have any other experience tips that you can give us, or anything like the most important takeaway from this training would be that's from the slide?
I think it's important to have like knowing how long he needs to nap during the day according to the age. We have a chart that we can share if you want.
Wonderful.
By the end of the night, that we can share how many minutes or how long the baby can sleep during the day, because that can change your night.
Yeah.
If the baby takes a lot of naps during the day, maybe at night it's gonna be
It's gonna be harder for nighttime sleeping, for sure. That makes sense.
Maybe during the day he takes his right nap, and the time it has to be, and everything, and now you're gonna have a good nap. Like the baby's gonna sleep all through the nap. It depends the age, and it depends that you follow the naps time.
Right, and those guys are just general, of course. Each child is different, each family is different. And so as you're communicating with your teachers, it's going to let them know what you're doing at home, how often they're napping, how long you want them to nap, and then we can take care of that here. Great. Well, after this live, if you like what you hear here or you want to enroll your little one, we do have some promotions going on. One of our promotions is free registration, which is $150 value. And if you want to set a tour, you can go to our website, which will be listed in the comments for you. And one of the things on the website, it will ask you how you heard about us. So you'll want to select promo, And then in the message comment, put Facebook Live. And then you can also be entered into a raffle to earn 1 week free tuition, which is wonderful too. So thank you so much for joining us for this live tonight. And we're looking forward to having many, many other events like this. And we'll upload some more resources like the charts that Stephanie was referring to and some examples of safe sleep sacks as well. Great, thank you.